Hey, what's up, everyone, and welcome back to The Sanctuary. I'm your host, Professor C, and we're going to be continuing our A&P lecture series here. Going to be jumping into bones, but specifically disorders of bones and some fracturing of bones. So, let's get into it. So let's start here by going through general classifications of fractures, then we'll get into some more specificities. So, the first thing you can consider, and there's four big ones here we're going to cover on the slide. Where is the bone parts after the break? That is the alignment of bone where it was previous to the break, or has it been displaced? So that's the term we use. Non-displaced fracture retains its normal alignment, and a displaced fracture is not aligned normally. The completeness of the fracture. Is the bone broken all the way through? Well, we call that a complete fracture. Is the bone not broken? Well, then it would be incomplete, right? Pretty much makes sense, I believe. Orientation to the long axis of the bone, something like this. If you had, let's draw our cartoon bone again. There it is. And the crack is like this, right? Running with the length of the long axis. That would be called a linear fracture, right? It's parallel to the long axis. If, however, the crack were like this, I'm drawing here, kind of like a transverse looking thing, that would be called a transverse fracture. It's perpendicular to the long axis of the bone. And then finally, does the fractured bone, does it actually protrude out of the skin? Does it penetrate and break through the skin where you can visibly see the bone? If it is, it's called a compound fracture. And if the bone is not visible through the skin, it's called a simple fracture. Even though it may not be so simple to heal or repair, simple refers to that it did not penetrate the skin. Okay, special types of fractures now. Comminuted, as you can see in this x-ray here, means the bone has been broken into many pieces. Usually we say into more than two. Some sort of bad event had to do this. This is not going to happen just walking down the street or something. Some sort of major trauma, some sort of substantial force or energy is required to do this, like a car wreck or you ski into a tree or something like that. Usually can't just splint this up or put a cast on it. Oftentimes you have to go in and clean up and repair the bone internally. Okay, compression fracture is, as it sounds like, something has been compressed. You can see that black arrow there pointing to the vertebrae that doesn't look the same as the vertebrae below it or above it. So this vertebrae right there has been crushed. You can imagine this, you're on a ladder and you fall off and land on your butt and you get a compression fracture. This often happens in car wrecks too, where people are seated in the car seat in strange positions. They can compress the vertebrae like this. So the body is the big thick part of the vertebrae. It collapses or gets crushed. It could hurt real bad if it influences the spinal cord. It can certainly cause deformity. Certainly can cause loss of height if it happens in enough of the vertebrae, right? Most common in the thoracic area. So in healthy people, this is usually caused by some sort of traumatic event, like a very hard fall, some kind of a crunching sports injury, and again, car accidents are very common in a lot of bone breaks. Spiral fracture has been twisted just like it sounds like. Sometimes you might hear the word torque. I'll put it up here, Torque, torque fracture, again implying some sort of twisting or turning, and that's exactly what it is, caused when a fracture is due to a twisting motion. Causes sometimes a corkscrew-like, break along the length of the bone, just like you see in the image here to the left. Almost always caused by a fall. All right, an epiphyseal fracture, again, as the name suggests, probably has to do with the tip of the bone and not the shaft of the bone. So some kind of a break near the growth plate, usually, or it could be near the epiphyseal line if there's some serious bone disease. So what you see right here, right here, the bone used to be connected to this here, but it has slipped off somehow. Again, probably in some sort of traumatic car event, something like that. A green stick fracture is, again, as it sounds like, if you go out in the woods and you grab a stick from a living tree and you try to break it, it doesn't just break. It kind of crunches a little bit and kind of bends and gets distorted, but it doesn't snap in half like a dried out old dead stick on the ground would. So this is the concept. You take a bone that's still really soft, like a child's bone, say, that hasn't developed all the way into harder bone. And so when it breaks, it doesn't like break all the way through. It kind of bends, it kind of cracks. You may see, as it shows here, a cracking here where I'm drawing this little arrow. You may see some compression on the other side where the bend has occurred. You may see different things with the green sticking. So as it says here, it looks like a green branch. It doesn't snap immediately when you bend it. And this is, again, very common in children under than 10 because their bones have not solidified as an adult's would, and they're a little bit more rubbery skeletons than an adult. Okay, a depression fraction, again, as it sounds like, but you usually talk about depression fractions being on the cranial bones, as is shown in these two pictures. Again, it could be from a violent car wreck where the head has hit the dashboard or the windshield really hard. It could be from, a sports injury where a baseball is slammed into you, or it could be from getting hit, say, with a hammer at some sort of a work site, or someone dropped something on your head from far above and caused part of the skull to be depressed into the skull further, near the brain. So some sort of crushing fracture of the cranial bone, pushing or depressing the bone matter closer to the brain. Depression fracture. Okay, some conditions of the bone, some abnormalities. Dwarfism being one that almost everyone has seen or heard about in their life at some point. It's quite common when you talk about bone disorders. So this is a condition where, as an adult, you're less than 4 feet 10 inches tall, or 147 centimeters. There are many causes for dwarfism, so you have no idea why someone would be shorter than someone else. 200, some sorts, even sources say there's 300 different causes of dwarfism, but most of them, it says here, 70% are caused by something called achondroplasia, and this is a genetic problem. And it just, the arms and the legs are shorter than normal. The torso's, kind of normal size. The head's kind of normal size, but the limbs are shorter than they should be. And this is an achondroplastic type of dwarfism. It's the most common form. The other 30%, a lot of them are caused by simply a deficiency in growth hormone. Some kind of gland in your brain that we'll talk about later doesn't produce growth hormone, or you're not using the growth hormone correctly that is being produced. So in general, people with dwarfism only have problems with their arms and legs being short. They usually have normal intelligence and live normal lifespans. Okay, Pagets disease. You can see how the bone is twisted here in these images. It looks like bowed legs, but this is something a little bit different. So an idiopathic deformity, meaning idiopathic, we don't know the cause of it. There are some ideas, right, but no direct cause is known yet. And you see dysregulated bone remodeling is the thing here. Dys is a key word for chaotic or craziness. So when the bone tries to remodel itself, which bones are doing all the time, based on how you're using them, the remodeling is dysregulated. It's not completely controlled. It's very chaotic. And so you see too much bone breakdown right here, and then disorganized bone formation. And the bones begin to lose their shape very quickly. Pagets disease. Osteopenia. Penia refers to a deficiency of something. So an osteopenic person would have some of their normal bone density missing or have gone away, right? Osteoporosis would be one step further. We have this chronic osteopenia where we've lost more than someone with osteopenia, and now the bones are on the verge of, being breaking or brittle. So osteopenia is just a loss of bone density. And it's common in people that get older, especially older than 50, and especially in women. If you don't treat this, meaning in diet or through exercise or whatever your doctor may talk to you about, this will progress. And it could progress to a condition known as osteoporosis. And then at that point, the bones become so weak, they could break, just under normal stresses. Just, lifting your leg up high could cause something to break. Or falling down and hitting the ground hard with an osteoporotic bone could cause it to break quite easily. There's something called a T-score that you could measure, and it would tell you your bone density and however many standard deviations. That's what the SD stands for down there in the colored arrow. The more you are away from what we call normal density is how they would rate that. You can look that up more if you wish, but I thought I would just mention how they determine that clinically. Okay, OI, Osteogenesis Imperfecta. Again, a lot of these pictures look the same, but you can tell if you look closely that some of these bones are malformed. Sometimes you hear this colloquially published in magazines called brittle bone disease. And it is not just a single problem, but it's a group of problems, about 20 of them, that result in the bones, being brittle or breaking easily. So 19 different genes are linked to, again, about 21 similar disorders, but each one being a different mechanism. And at some point, the mechanism is linked to faulty type 1 collagen. So collagen in connective tissue is not being formed correctly. And as the bone tries to reform itself, it doesn't lay down enough of it, or it's defective, and the bone becomes brittle, easily broken. Okay, rickets, you may have heard, is a childhood disease. We don't hear so much of it in this country, but in lots of parts of the world, this is still quite an issue. It has to do with dietary problems. If it happens in an adult, we often call the term Osteomalacia. So they're often talked about together, and I'm going to do the same thing here. So rickets is a childhood problem that causes soft bones. And of course, if you have soft bones, they're going to look technically correct, but they should, bow out under stress. So you get this very common bow-legged appearance to a child with ricket deformities. Now, of course, we all know, because this is a very common one you hear about, it's just from too little vitamin D or calcium in your diet. And that's why you see that in lots of parts of the world still today, because the diets are terrible. People are on the verge of starvation. They're not getting enough vitamin D or calcium. And it says there it's largely preventable with a healthy diet. But it's hard to get a healthy diet if your country's fighting a war, correct? It's very hard to do. So I said adults can experience similar conditions to this, but it's not called rickets, it's called osteomalacia. All right, we got osteoarthritis, or OA, and rheumatoid arthritis, or RA. Again, this has something to do with the joints, especially joints between the bones, right? That would make sense. So itis is an inflammation of something. Arthur refers to the joints, right? And the bone tissue around the joints. So osteoarthritis and rheumatoid arthritis are diseases of the joints. A little bit different in their mechanism, but both can be debilitating, both can be painful. So OA, osteoarthritis, is a degenerative joint disease that occurs usually in the hands and the hips and the knees. Cartilage breaks down, and then as the cartilage breaks down, the bone underneath it starts to grind together, and it starts to cause abnormal changes in the bone below the joints. Rheumatoid arthritis is a problem where your immune system is attacking your own tissue. It's called an autoimmune disorder, and it causes, or is a result from, chronic inflammation. It seems to be kind of like a deadly loop that feeds back on itself. You get inflamed, and then your immune system tries to help, but ends up doing more hurt, which causes more inflammation, which causes more immune response, and you get this spiral out of control where the joints become torn apart in ways that makes them unusable, or it could cause distortions in the hands like you see on the right. Okay, hope you enjoyed that one on fractures and bone disorders. Thanks for watching it to the end there. Check out some other videos in my series if you would like some more free information. See you on the next one. Bye-bye.